Order. Question number 4. Paul Foster-Bell.
Thank you very much, Mr Speaker. Sir, my question is to the Minister of Health and asks, what steps is the government taking to improve access to primary care for New Zealand families?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Fantastic news, Mr Speaker. From today, all New Zealand children aged under 13 will be eligible to access free GP visits at any time of the day or night, as well as free prescriptions. Over 400,000 children will benefit from this announcement. Yesterday, their parents had to pay to take them to the doctor and get a prescription. Today, it's free. That's on top of 350,000 under 6s who already benefit from free GP visits and prescriptions. This policy will see about $120 million spent over the next 3 years to deliver high-quality health care for under 13s. The government is committed to supporting families, and we want to ensure that children get the best possible start in life.
Supplementary question, Paul Foster-Bell.
Supplementary to the Minister, what impact will this policy have on other areas of the health system?
Mr Speaker.
Honourable Dr Jonathan Coleman.
Mr Speaker, free GP visits for under 13s were rolled out in the Northland District Health Board 9 months ago. Shh, just listen, it's good. Preliminary results from the DHB's hospitals indicate that emergency department presentations by children aged between 6 and 12 have fallen by 10% since the policy was introduced, and the number of prescriptions filled has risen by 18%. This shows that parents are getting their kids treated sooner, which means better health outcomes for those children, with fewer presenting later and sicker, which of course also takes pressure off our emergency departments and our hospitals.
Supplementary.
Supplementary question, Paul Foster-Bell.
Further supplementary to the Minister. What other pleasant surprises are there for people who support the policy but are concerned about its uptake?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, I've seen concerns raised by serial health correspondent Mrs A. King of Haitaitai, stating that while she strongly supports this government policy, she was worried that the uptake of the policy would not be very high. She will be thrilled to know that while the level of uptake for the free under 6s policy launched in 2008 was a solid 70% of GP practices, the day one uptake of the free under 13s policy is a remarkable 96% of GP practices, covering 98% of children, with 95% of children also receiving free ACC consultations. I'm delighted to be able to put Mrs King's concerns to rest and encourage her to continue with her liberal praise of government policy.
Point of order, Mr Speaker.
Party vote.
Order.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
Point of order, Mr Speaker. I can assure you my late mother-in-law, Mrs A. King of Haitaitai, never wrote any of those letters.
And that's hardly a point of order, but a fair response. Question number 5, Grant Robertson.
Point of order.
Oh, point of order.
Mr Speaker.
Order.
The Minister.
Order. I haven't called the member yet.
The Minister.
Order. This is a point of order. I expect to hear it in silence. The Right Honourable Winston Peters.
Mr Speaker, the Minister seemed to be quoting from an official document about day one's uptake. I wondered whether he'd table it.
Order. This matter's easily resolved. Is the Minister quoting from an official document?
Well, yeah, we will be able to put that as an official document on the table. Those are official figures from the Ministry of Health today.
It's a simple matter. It doesn't need further debate. If it is an official document, the call has been made for it to be tabled. It will be tabled. Question number 5, Grant Robertson.
Thank you, Mr Speaker. My question